This presentation contains references to and images of medical discrimination, ableism, and abuse.
My voice is important. I've been living here 11 years now. A good doctor would be friendly and kind of tell you exactly what you need to do to stay well in communication. Yeah. Past didn't treat me right, you know what I mean? I said, look, that hurts. And I was reaching to get my call button, call the nurse, and he grabbed it away from me, out of my hand.
Go ahead, Charles, it's your turn.
That's being aggressive. I don't like those kind of doctors, you know. Be kind and gentle and not be rough and grab things out of my hands. I'm a priority, and doctors should treat me right and tell me what's wrong. I have human rights. I'm no dummy. Human being. And I'm gonna be treated like one, not like a 5-year-old boy. My voice is important to make sure other people hear.
Hello, and thank you for joining us for My Voice, a project sponsored by the DC Developmental Disabilities Council and created by L'Arche Greater Washington, DC. My name is Eva Elizabeth Chisholm, and I have the privilege of serving on the leadership team at L'Arche Greater Washington, DC. The goal of My Voice is to amplify the voices of people with intellectual disabilities within the healthcare system and to provide practical tools to practitioners, students, and advocates. People with intellectual disabilities have a history of being ignored and neglected by society. In particular, the institutionalization of people with intellectual and developmental disabilities, or IDD, led to many human rights abuses. State-run institutions were understaffed and overpopulated, and abuse and neglect of residents was prevalent. At the height of institutionalization in 1967, over 194,000 people with disabilities lived in state-run institutions. Due to our nation's shameful history of institutionalization, people with IDD have frequently been silenced, forgotten about, and abused, particularly in clinical settings. The disability rights movement, guided by people with disabilities themselves through organizations such as the ARC, Special Olympics International, L'Arche International, and many others, has focused on amplifying the voices of people with IDD since they have too often been silenced. The goal of this project is to continue on this path by bringing the voices of people with IDD to future doctors and clinicians. By asking yourselves questions about how you, as a healthcare provider, can be more inclusive and accessible, you will learn to create a better experience for both you and your patients, those with and without IDD. Founded in 1983, L'Arche Greater Washington, DC is a community of people with and without intellectual disabilities sharing our lives together. We celebrate the unique value of every person, recognizing and accepting our need for each other. L'Arche's mission is to make known the gifts of people with intellectual disabilities, revealed through our mutually transforming relationships. To accomplish our mission, L'Arche supports community life in 2 homes in Washington, DC, and 2 homes in Arlington, Virginia, that together support 14 members who have intellectual disability, known as our core members, those whose presence is at the heart of our homes. L'Arche also welcomes assistants to our homes who engage in daily life alongside core members through relationship and companionship, providing support with social, emotional, and medical needs. The assistant-core member relationship is at the heart of what makes L'Arche a unique and irreplaceable resource for DC area residents with developmental disabilities. A patient's experience in the waiting room sets the scene for the rest of the appointment, and it is essential to set a tone of respect and welcome at the beginning of the appointment. One of the first things a patient will notice is how accessible your office is to them. Can their walker or wheelchair easily fit through the doorways of your office? Are your entrances equipped with handicap-accessible automatic doors? Is your waiting room seating comfortable and accessible? Are chairs configured such that people with adaptive equipment can easily move in the waiting room? Consider having a few seats in the waiting room set aside as priority seating for your patients with mobility needs. This way, even on a particularly crowded day, patients with disabilities can be assured of seating. Patients with sensory sensitivities should also be considered. Your patients with autism spectrum disorder in particular may show heightened sensitivities to noise, visual stimuli, and tactile stimuli. According to some studies, between 69 and 95% of people on the autism spectrum struggle with sensory sensitivities. This means that music and television programs in waiting rooms that might seem unobtrusive to the average patient may be overstimulating and even sometimes painful for some patients. Patients who experience sensory overload in the waiting room are also more likely to have behavioral episodes and anxiety before the appointment, and this could impact his or her overall experience in the doctor's office and impact how well you are able to interact with and examine him or her. If you know a patient is prone to sensory overload, think about how you can make your waiting room more accessible to him or her by turning down the volume on the TV and radio, or trying to limit their time in the waiting room. Consider giving them the option of bringing them back to the exam room early. It's also helpful to consider whether the materials in your waiting room are accessible. Do you have magazines available with large print? Or do you have waiting activities that could be accessible to patients with disabilities? Accessibility is very important in the exam room. Check to make sure that all of your exam room doorways are wide enough to allow a wheelchair or walker to pass through comfortably. In addition, think about the design of your exam rooms and ask, are there any unnecessary chairs crowding the room? Exam tables are also not always physically accessible, and it can be difficult for people who use wheelchairs, walkers, or may have experienced falls or have balance issues to get themselves safely on and off an exam table. It is often helpful to consider the option of doing an examination from a chair. Medical professionals should also consider the accessibility of the instruments they use. This includes things like scales, height measurements, and thermometers. Consider having a scale fitted with handlebars for easy access for people with mobility concerns, or a forehead or ear thermometer that could be preferable to some patients with sensory sensitivities. It is often a good idea to ask the patient or their support staff how they usually take their height, temperature, and weight at home. In light of the coronavirus pandemic, telehealth has both opened up opportunities and presented challenges in terms of accessibility. Some helpful things to keep in mind include your lighting. Can your patient clearly see your face, or are you backlit? Patients with hearing impairments or those who may process verbal communication more slowly really benefit from having a clear view of the speaker's mouth. Also think about the volume, your tone of voice, and your enunciation. We've all experienced a lag or delay on virtual platforms. And speaking more slowly and offering more frequent pauses can help minimize the experience of talking over each other or not getting the full message. Consider offering a brief training guide or a how-to guide to your patients on your webpage. This can really help ease some of the emotional stress and frustration that comes with learning new technology. It is also important for doctors to keep communication needs in mind in the exam room. It may be difficult for some of your patients with disabilities to rate their pain according to a numerical scale. It can be helpful to use alternative methods of rating pain, such as an emoji scale, or asking questions such as, what does it feel like, as opposed to, what number are you on a scale from 1 to 10? Pictorial aids can also be helpful to get a read from the patient on where on the body they are experiencing pain, or asking them the types of fruits and vegetables they like to eat, or the types of exercise they participate in, or even the methods of medication administration that they prefer. In addition to using pictorial aids, it may be important to pose a series of yes or no questions to gain clarity on how your patient is doing. For example, asking, does your arm hurt, or do you have pain somewhere, instead of asking a more broad question of, where does it hurt? If you're feeling unsure of how to communicate best with a patient, ask them directly or reach out to their circle of support. It's also important to express to your patient that you're having a hard time understanding them, so everyone can ensure better communication. Don't be afraid to ask questions or acknowledge if you don't understand. It's also helpful to give advance warning to the patient and their support team when scheduling an appointment if any tests will be needed. Some patients with disabilities may need to be reminded to drink enough water before the appointment in order for testing to be more comfortable. When you're prescribing a new medication to a person with a disability, it may also require some additional consideration. Before prescribing the new medication, please thoroughly check with the patient, their circle of supports, and past medical records. It is important to consider other meds they may have been on and their response to similar medications in the past. Many people with IDD take daily medications that need to be considered when prescribing new medications. People with IDD may be less able to remember or communicate an adverse drug reaction than your other patients. And additionally, support staff might only have a limited medical history of the patient. They might have worked with the patient their entire life, or only for a few months. Particular care and attention to medical history is needed when prescribing new medications to patients with IDD. In the exam room, it is imperative to be mindful of anxiety and past uncomfortable experiences when working with patients with disabilities. People with IDD are up to 10 times more likely to experience abuse. According to one study, 49% of people with disabilities will experience 10 or more incidences of abuse in their lifetime. Researchers have also found that more than 90% of people with intellectual disabilities will experience some form of sexual abuse at some time in their lives. Up to 85% of cases of abuse go unreported in congregate settings. It is a good idea to talk with the patient and their circle of support about knowing how to make doctor's visits more comfortable. In particular, be mindful about telling the patient, in the communication format that works best for them, exactly what you are going to examine or touch before initiating any physical examination. Word choice matters to people with IDD. Please do not talk down to people with IDD or use baby talk. It is offensive. While you may need to talk more slowly or use simpler vocabulary for some patients, you should be attentive to your tone and voice and treat people with IDD in a manner consistent with their age. Speak to the patient and not just about them. Just as you would not address any other adult patient as honey or sweetheart or precious, you should not use these names in talking with or about people with IDD. Use correct terminology when referring to a person with IDD's disability or medical conditions, and adhere as much as possible to person-first language. If you are not sure of how to refer to something, ask. Mental retardation is no longer a correct medical term. It is offensive to people with IDD, and we prefer that you use intellectual disability instead. Talk with the patient, not about the patient. The patient is the most important person in the exam room. Make sure that all talk of patient health is directed first to them and to the patient and their supporters as a team, not just to the supporters or assistant. Choice is important. People with disabilities want to be heard, and their priorities may be different than your own.
My name is Eileen Schofield, and I've been enlarged 30 years. When I get ready to go to the doctor, they get my books out and I can go to the doctor. I like them because I can go see them. I can talk to my doctor about if I'm getting sick or something. They help me if I have a cold, if I had my back hurt. They done good. They done really good for me. The good doctor is when the patient come in, get attention to him, and that way he'll be calmed down. Time and attention from my doctor. My voice is important. Let people know that I need help, and I'm a corps member.
The large Greater Washington, D.C. website has more resources available for ongoing learning. Our partners at the D.C. Disability Council are also a great resource. And for current doctors and nurses, Special Olympics International also has a variety of resources. Thank you so much for attending this session. We're hopeful that from this presentation, you'll be empowered to increase inclusivity and accessibility in your fields of practice. We would like to thank the DC Developmental Disabilities Council for their partnership in creating the My Voice project. We would also like to thank the Comcast NBC Universal Foundation for their support through a Project Innovation Grant. special thanks to our panel of assistants, core members, and doctors, and to you, the viewers, for making this My Voice project possible.